Hello and welcome. My name is Elizabeth Atkins. Since 2011, United Home Healthcare has provided in-home health care to thousands of Medicaid recipients across the state of Michigan. The goal of United Home Healthcare is to provide assistance in maintaining independent living status and quality of life in your home and to avoid placement in a nursing home, adult foster care, or alternative care facility. United Home Healthcare is committed to strengthening your natural support system whenever and wherever possible, and by assisting you in the independent lifestyle you are accustomed to, deserve, and are entitled to. This program is designed so that you can choose your loved one, friend, or acquaintance to do what many of them are already doing for free. Only with United Home Healthcare, we will pay them to do what they're already doing for free. Over the next few minutes, we're going to walk you through the process of enrolling in the healthcare program at absolutely no cost to you. So let's get started. Let's begin by discussing the activities of daily living, or ADLs, instrumental activities of daily living, or IADLs, and complex care. ADLs consist of eating and feeding, taking medications, toileting, meal preparations and cleanup, bathing, shopping for food and other necessities of daily living, grooming, laundry, dressing, housework, transferring, mobility, and range of motion. IADLs include complex care, specialized feeding, catheter or leg bag colostomy, bowel program suctioning, and bed sore prevention. Note, we strongly advise you to make regular entries in the daily log provided to you by your caseworker. Your United Home Healthcare Intake Coordinator will ask you to provide the vital information they will input onto the intake referral form. Please fill out the following information as completely as possible: client name, address, phone number, social security numbers, Medicaid number, Medicare number if applicable. And upon selecting your caregiver, please fill in their vital information, the same as in the above items mentioned previously. Once you complete that information, we will mail you the medical needs form, which we'll talk about later in detail. Note, in instances where the caregiver is a family member or friend, if the state of Michigan caseworker should ask you if the caregiver would perform the same services if they were not being paid, the caregiver should always answer no. The caregiver cannot continue to provide services without compensation. It may take as long as 2 to 3 months for the State of Michigan Department of Human Services to complete the approval process of home health care services, but not to worry. Your payment will be retroactive to the date the Department of Human Services receives the medical needs form, and your start date will be the completion date of the final assessment conducted by the State of Michigan caseworker. Payment from the application date or final assessment date, which is the date the intake coordinator and the caseworker come to your home to determine if your case has been approved, the amount, or if the case has been denied. The back pay date is the only item which is at the sole discretion of the caseworker. Here's an example. Let's say that you've been approved to receive $200 per week for in-home health care. It normally takes the state of Michigan 8 weeks to process the approval and remit payment. The payment will be sent from the state of Michigan to United Home Healthcare, and in turn you will receive the amount of $1,600, which is the $200 weekly amount times 8 weeks it took the state of Michigan to process the application. Your start date could possibly be the date on the medical needs form and the patient application form for adult care services as received by the state of Michigan. Our customer service department is available to you Monday through Friday during normal business hours. If you are unable to contact your intake coordinator directly, call this toll-free number, 855-978-4357. That's 855-978-HELP, and select extension 2. The medical needs form determines whether or not United Home Healthcare will be authorized to start the process of providing home health care. Once this form is filled out by your physician or designated healthcare professional, notify your intake coordinator who will coordinate the receipt of the document and turn it into the State of Michigan Department of Human Services, where the approval process will begin. In other words, until this critical form is filled out and returned to United Home Healthcare, there will be no payment for services rendered. The medical needs form is one of the important pieces of information in determining the amount caregivers are paid. One of the most critical areas of the medical needs form is located in section I, as in the letter I, not the number 1, of the form. Please pay very close attention to section I. You will see the tasks to be specified for approval for services. Your healthcare professional responsible for filling out this section must specify every area impacted by the severity of your diagnosed condition. For example, if you have back or shoulder problems and cannot strap a bra or put one arm in a sleeve, or you have trouble bending over, pulling up undergarments, pants, skirts, etc., those are areas where you need help with dressing, as specified in the following areas of the form: dressing, mobility, bathing, grooming, shopping, laundry, and housework. You must communicate these needs in as clear and understandable ways as possible so your healthcare professional can circle them in section I. Failure to specify these areas in as great a detail as possible could result in the following consequences: rejection of your application by the State of Michigan Department of Human Services, denial of your application by the caseworker, your caregiver being underpaid for services rendered. The medical needs form must be filled out by a certified registered healthcare professional such as your doctor, nurse practitioner, physical therapist, occupational therapist, or a designated, licensed, registered healthcare professional assigned by your primary care physician attending to your case and records. All appointments with visiting doctors, therapists, and other healthcare professionals must be kept, if possible, to ensure proper evaluation and to help determine the correct amount of hours for your caregiver. Adult chore services is provided through Medicaid. Because of this, your visiting doctor, therapist, and/or nurse cannot answer any questions regarding the Department of Human Services adult chore services. Remember, for any questions regarding your particular case, always contact your United Home Healthcare intake coordinator. If you are assigned a visiting doctor, he or she will not take the place of your assigned primary care physician. Your healthcare professionals are recognized by the State of Michigan as the designated authorities responsible for your good health and well-being. Therefore, this form is vital to your health and well-being for in-home health care and identification of your medical needs. You may not have to schedule an appointment with your physician to have the medical needs form completed. Perhaps you can call and speak with the office manager of your need to bring the form in so that a certified medical professional can fill out the medical needs form. Upon completion of the medical needs form, please contact your intake coordinator who will schedule an appointment with you to sign your paperwork. The caseworker is the representative for the State of Michigan. United Home Healthcare complies with State of Michigan mandates to ensure that the proper services are approved for payment. Like the IRS, for example, who may trigger an audit if 1 cent on your income tax return is not accounted for, the State of Michigan may reject any services if the proper information in the proper format at the specified hours within the specified time frames are not filled in and submitted correctly. United Home Healthcare will help ensure that you have the correct information in every applicable area in ensuring your caregiver receives payments for services at the maximum allowable levels across the board. The caseworker's commitment is to deny or approve at reduced hours. Our job is to see to it that you are approved at the highest amount of hours. For any questions regarding payment cycles, please log on to our website at www.uhhc.care. After electronic funds have been received from the state of Michigan, you will receive a debit card from United Home Healthcare where your funds will be immediately accessible. Caregivers must start with this patient, but can service as many patients as desired. There is no limit of clients, and caregivers can perform services for as many clients as they can handle. The intake coordinator will be in contact with the patient every week until the case is approved by the state of Michigan. Once services are approved, the United Home Healthcare Customer Service Department will be in contact with the patient on a monthly basis as well to ensure that the services being rendered are to their satisfaction. Remember, your intake coordinator will be in contact with you every single step of the way, generally once a week, until your caregiver receives their first payment. In the event that you cannot reach your intake coordinator within a 24-hour period, please call the United Home Healthcare Customer Service Department during normal business hours at this toll-free number, 855-978-4357. That's 855-978-HELP, and select extension 2. Once your paperwork has been processed, United Home Healthcare will submit your application and medical needs form to the State of Michigan Department of Human Services, where your case should be opened and your caregiver should receive their first payment with back pay in 30 to 60 days. If you already have an open case with the State of Michigan for adult chore services and choose United Home Healthcare as your new provider, you will need to do the following. First, contact your caseworker while your United Home Healthcare intake coordinator is on the phone. The purpose of the call is to authorize United Home Healthcare as your new provider and to schedule an appointment with your caseworker. Once your appointment is scheduled, United Home Healthcare will need to meet with the caseworker in person at the Department of Human Services so that United Home Healthcare can fill out the Statement of Employment form in order to switch you from another agency or the state of Michigan to United Home Healthcare. If United Home Healthcare switches your case over in the middle of a month, there is the possibility that your payment cycle may be delayed a week or two. If that delay adversely affects your financial situation, United Home Healthcare can change that date to the first of the month. The provider change will take place in your presence, the caseworkers, and our United Home Healthcare personnel. If the caseworker does not process the change in an expeditious manner, United Home Healthcare can start the payment cycle effective the first day of the month to avoid any further delays in your payment. Depending upon when the effective date of the switch is going to occur, such as which day in the month the change is made from the state of Michigan to United Home Healthcare, you will receive payment from the state of Michigan depending upon what date you choose as the effective date based upon your personal obligations and financial needs. Once United Home Healthcare has completed the above, the effective date can occur immediately or up to 1 month, depending upon the caseworker. Please make certain that you request new logs from your caseworker showing the change of providers. Also, be sure to request a time task proposal form, which must be obtained by your caseworker. The following forms are essential to the completion of your enrollment. Conversation checklist. This document is designed to provide you with an understanding of United Home Healthcare's role as your representative and provider, and how United Home Healthcare will guide you through this process in conjunction with the State of Michigan Department of Human Services. For those with dual insurances, Medicaid and Medicare, all appointments with visiting doctors, therapists, etc. must be kept, if at all possible, to ensure proper evaluation of the patient in helping to determine the correct amount of hours for your caregiver. Understand that adult chore services is provided through Medicaid, so your visiting doctor, therapist, and/or nurse cannot answer any questions regarding the Department of Human Services adult chore services. Remember, for any questions regarding your case, please contact your intake coordinator. If you are assigned a visiting doctor, he or she will not take the place of your assigned primary care physician. The service agreement between United Home Healthcare and patient. This is the contractual agreement between the provider, United Home Healthcare, and the client, you, which breaks down services that will be provided by the caregiver of the patient. The hold harmless agreement. This form basically says that because the caregiver is one of the patient's own choosing and the relationship between them is ongoing, they will hold United Home Healthcare harmless from any legal action or disputes which may arise as a result of any conflicts from their interaction. The authorization to disclose protected health information. This document authorizes United Home Healthcare and an affiliated approved third party to request or see information relating to the client's health or referring you to third-party sources such as durable medical equipment providers, doctors, nurses, therapists, and so forth. The Adult Service Application. This document is the application for services to help in paying for someone to assist with personal care and housekeeping services. The HIPAA Disclosure Authorization. This is the form required by HIPAA, which means the Federal Health Insurance Portability and Accountability Act of 1996. Law, which authorizes United Home Healthcare and its approved affiliates to use disclosed and protected information related to this application. The Home Help Service Statement of Employment. This form is utilized to authorize United Home Healthcare to serve as the client's registered provider with the state of Michigan. The Independent Contractor Service Agreement. This document discloses that the client is an independent contractor who will be receiving an annual 1099 form as opposed to an employee who would receive an annual W-2 form. It also breaks down the duties the caregiver will be providing to and for the client. It also provides scheduling for duties performed as available according to the patient's schedule in accordance to the hours approved by the state of Michigan upon the opening of the case. The Transportation Waiver. This document states that the caregiver will not transport the patient on contracted time to perform any services whatsoever. However, they can perform errands, but not with the patient in any vehicle during contracted time for services. The agreement concerning repayment. If for any reason the state of Michigan deducts monies from future payments, for example, due to hospitalization where payment was made for home health care services, you will be liable to pay the money back to United Home Healthcare. The W-9. This form is what the IRS requires United Home Healthcare to have the caregiver fill out. W-9, Contracted Caregivers Form. This provides verification of 1099 status. For all forms signed, a copy of each document will be provided via email upon completion of the process from the intake coordinator upon request. The caseworker will not always be in a position to notify you in advance of a visit to your residence. Therefore, please make certain to have your house in decent, respectable, clean, and neat order at all times. If the caseworker conducts an unscheduled visit or makes any contact at all, be sure to contact your United Home Healthcare intake coordinator immediately. If the intake coordinator does not respond or cannot be reached, please call the United Home Healthcare Customer Service Department during normal business hours at 855-978-4357, which is also HELP, extension 2. If your caregiver is present, do not allow your caregiver to sign any documents presented by the caseworker without the presence of your intake coordinator. If you allow your caregiver to sign your documentation, you will receive a lower hourly rate of pay. Please have all walking aids, such as a cane or walker, wheelchair, etc., ready and accessible at all times. Also, always have your medication available when the caseworker conducts an inventory of your prescribed medication. Payment expectations. There will not be a payment for your caregiver until your case is approved and turned on by the state of Michigan. Referrals. The caregiver can service multiple patients. If there are other friends and family members who may need this service, please have the prospective client contact the intake coordinator and note that the referral came from you. For example, if the caregiver has one patient and is earning $500 monthly, but now is servicing 5 patients every month, they would earn $2,500 each month. Communications expectations. United Home Healthcare will be in contact with you once a week until United Home Healthcare has your case opened. Calls. For any questions, please contact your intake coordinator or customer service. And when contacted by the caseworker in any form of communication, please contact your intake coordinator or the United Home Healthcare Customer Service Department during normal business hours at 855-978-4357, extension 2. Text messages. Be sure to provide United Home Healthcare with your cell phone number so your intake coordinator or the United Home Healthcare Customer Service Department representative can give you important reminders, such as late payments and changes in policy or procedures. The United Home Healthcare Customer Service Department. In the event that you are unable to contact your intake coordinator within a 24-hour period for any reason whatsoever, please call the United Home Healthcare Customer Service Department during normal business hours at 855-978-4357, extension 2. Moving. If the caregiver or the patient has changed their address, please note that it is very important to contact the United Home Healthcare Customer Service Department during normal business hours at 855-978-4357 immediately to ensure that tax information, payment information, 1099 statements, and any other important information can be sent to the proper address. Change of phone number. If the caregiver or the patient has changed their phone number, please note that it is very important to contact United Home Healthcare Customer Service Department during normal business hours at 855-978-4357, extension 2, immediately so that any other information and important notifications can be communicated in a timely manner. Caseworker change notice. The state of Michigan does not notify United Home Healthcare when there is a change in your caseworker. Therefore, please notify United Home Healthcare immediately when you are notified of a change in your caseworker. The person you selected to perform your daily care is your caregiver. United Home Healthcare is your provider. Please note the difference between your provider, United Home Healthcare, and your caregiver. If you are asked the question, who is your provider? Please respond by answering United Home Healthcare. If asked the question, who is your caregiver? Please respond with the name of your chosen friend, loved one, or acquaintance. You need to be very specific when communicating with your caseworker regarding your ailment or condition. For example, if your caseworker asks you, what all is wrong with you? What are your ailments? Please do not be general or unspecific in your answer. Always give your caseworker your medically diagnosed conditions such as, I have a pinched nerve or I have scoliosis. Regardless as to how small you think your ailment is, be sure to communicate the limitations that your ailments impose upon your mobility and ability to function with even the most minor chores. Many times your condition may be minimalized in your own mind because symptoms may not always be constant. yet they are persistently causing you pain, discomfort, and limited mobility. So do not underestimate your condition, no matter how great or small. Be sure to communicate in as great a depth and detail the description of your condition as possible. The caseworker will ask you a question. Tell me, what do you need help with? Or why do you need this home help service? Your answer must be specific and detailed regarding what you need help with and why you need home help care. For example, in answering the question, what do you need help with? Your response should be taken from the 12 items identified in the ADLs and IADLs list identified in the medical needs form. Should your caseworker ask you the question, can you cook your own meals? Please respond based upon your medical needs form responses and refer to section I on that form. For example, I am unable to cook and prepare my own meals because my arthritis will not allow me to stand long enough to prepare the meal. All of the selections circled by the healthcare professional in section I of the medical needs form should be substantiated verbally by you with explanations as to why you need assistance in those areas. Note to caregivers, please understand and be knowledgeable of your patient's physical and mental ailments and every task which they need assistance with based upon section I of the medical needs form. With any aids that you use in walking, sitting, or standing, please have them with you or close by so that the caseworker can see them in plain sight. For any help devices such as a bath chair or breathing devices which you may not have in close proximity, please be sure to advise your caseworker that you have them and that you use them. Also know that your caseworker may want to go to the area of the home where the devices are located. Please have all medications visible and within sight unless meds are needed to be refrigerated, such as diabetes medication, for example. All medications must be up to date. The caseworker will not accept expired medications. United Home Healthcare understands that pets, for many, are treated like members of the family. However, when the caseworker arrives, you must secure your pet. The state of Michigan will not cover any costs for animal or pet care. The caseworker is the representative for the state of Michigan and represents their interests. The state imposes strict standards. United Home Healthcare must comply with the state's rules to the letter to ensure that the proper services are approved for payment. Like the IRS, for example, who may trigger an audit if 1 cent on your income tax return is not accounted for, the state will reject any services if the proper information in the proper format at the specified hours within the specified time frames are not filled in and submitted correctly. As your representative, United Home Healthcare, as your provider, will ensure that you have the proper information in every applicable area to ensure your caregiver receives payments for services at the maximum allowable levels across the board. The caseworker's commitment to reduce your approved hours is their responsibility. Our job is to see to it that you are approved at the highest amount of hours. The caseworker will try to persuade you to dismiss your home health care representative and attempt the process of health care between you and the state of Michigan. United Home Health Care is your advocate. If United Home Health Care is excluded, your caregiver will be paid less than we, as your provider, will pay your caregiver for home health care services. The caseworker's commitment is to deny or approve at reduced hours. Our job is to see to it that you are approved at the highest amount of hours. Note to caregiver, please be advised that the caseworker may ask for your driver's license and/or social security number. You are not obligated to provide this information under any circumstances. As an independent contractor of United Home Health Care, United Home Healthcare will provide all necessary documentation in order to trigger your payments. Once the caseworker completes your assessment and your case is approved, your caregiver should receive payments within 30 to 45 days and once a month after that. Note, for any questions regarding payment cycles, please contact the United Home Healthcare Customer Service Department during normal business hours at 855-978-4357, extension 2. After electronic funds have been received from the state of Michigan, you will receive a debit card from United Home Healthcare where your funds will be immediately accessible. Note, also be sure to request a time task proposal form, which must be obtained from your caseworker. Logs must be completed every 3 months or quarterly. At the end of the 3rd month, you must submit your logs to United Home Healthcare immediately in order that they are submitted to the Department of Human Services in a timely manner and to avoid your case payments being interrupted. Note, in the future, this reporting system will move from a paper-generated system to computer-generated logs. The frequency will move from every 3 months or quarterly to a monthly basis. The United Home Healthcare Customer Service Department will be in contact with you once a month from this point forward to ensure that you are satisfied with the level of service that you're receiving. Calls. For any questions, please contact your intake coordinator or customer service. And when you are contacted by the caseworker in any form of communication, please contact your intake coordinator or the United Home Healthcare Customer Service Department during normal business hours at 855-978-4357, extension 2. Text messages. Be sure to provide us with your cell phone number so your intake coordinator or the United Home Healthcare Customer Service Department representative can give you important reminders such as late payments and changes in policies and procedures. In the event you are unable to contact your intake coordinator within a 24-hour period for any reason whatsoever, please call the United Home Healthcare Customer Service Department during normal business hours at 855-978-4357, extension 2. Moving. If the caregiver or the patient has changed their address, please note that it is very important to contact the United Home Healthcare Customer Service Department during normal business hours immediately to ensure that tax information, payment information, 1099 statements, and any other important information can be sent to the proper address. Change of phone number. If the caregiver or the patient has changed their phone number, please note it is very important to contact the United Home Healthcare Customer Service Department during normal business hours at 855-978-4357, extension 2, immediately so that any other important notifications can be communicated in a timely manner. Caseworker change notice. The state of Michigan does not notify United Home Healthcare when a new caseworker has been assigned to your case. Please contact the United Home Healthcare Customer Service Department immediately during normal business hours at 855-978-4357, extension 2, when there is a change in your caseworker. In the event that you wish to select another caregiver to perform chore services, please contact your intake coordinator or customer service so that United Home Healthcare can send you a change of caregivers form immediately. The effective date of change of caregivers can only be made in writing by completing and submitting this form to your United Home Healthcare intake coordinator, or log on to our website at www.uhhc.care. Note to caregivers, you don't have to wait before your first client is approved for home health care. You can start soliciting more patients right now. Please feel free to go out and solicit new clients to increase your patient load. You can service as many patients as you desire. There is no limit. You can perform services for as many patients as you can handle. When you acquire new patients, call your intake coordinator immediately to begin the intake process. Note to patients, if you know of anyone who can benefit from the services that United Home Healthcare provides, please feel free to recommend us to the prospective client or provide us with their contact information. Please contact your intake coordinator if your caseworker with the Department of Human Services ever changes. This concludes the presentation of our United Home Healthcare enrollment and ongoing procedures. Always remember, our United Home Healthcare Customer Service Department is here to help you Monday through Friday during normal business hours. If you are unable to contact your intake coordinator directly, call this toll-free number, 855-978-4357, extension 2. For the entire United Home Healthcare team, thank you for joining us. I'm Elizabeth Atkins.